1. A client with heart failure is prescribed furosemide. Which lab value should the nurse monitor closely? A. Sodium, B. Potassium, C. Glucose, D. Calcium. Answer: B. Potassium. 2. Which is a priority intervention for a patient post-thyroidectomy? A. Monitor urinary output. B. Maintain a high-fiber diet. C. Assess for signs of hypocalcemia. D. Encourage fluid intake. Answer: C. Assess for signs of hypocalcemia. 3. A client with COPD is on 2 L per minute oxygen via nasal cannula. Why is this important? A. It prevents CO2 buildup. B. It prevents oxygen toxicity. C. High O2 causes hypertension. D. High the 2nd of may suppress respiratory drive. Answer: D. High the 2nd of may suppress respiratory drive. 4. Which assessment finding is most concerning in a post-op abdominal surgery client? A. Abdomen firm and distended. B. Hypoactive bowel sounds. C. Pain at incision site. D. Slight serosanguinous drainage. Answer: A. Abdomen firm and distended. 5. A client with DA presents with Kussmaul respirations. What does this indicate? A. Fluid overload. B. Respiratory infection. C. Compensation for metabolic dosis. D. Neurologic impairment. Correct answer: C. Compensation for metabolic acidosis. 6. Which complication is most associated with central venous catheter placement? A. Pulmonary embolism. B. Pneumothorax. C. Sepsis. D. Cardiac tamponade. Answer: B. Pneumothorax. 7. A patient with severe pancreatitis has hypocalcemia. Which finding is most expected? A. Bradycardia. B. Decreased bowel sounds. C. Diminished reflexes. D. Trousseau's sign. Answer: D. Trousseau's sign. 8. Priority nursing action after thyroidectomy with hoarseness and stridor? A. Administer IV calcium. B. Elevate Hobbs. C. Call rapid response. D. Apply oxygen. Answer: C. Call rapid response. 9. What is a late sign of increased intracranial pressure, ICP? A. Nausea. B. Bradycardia. C. Headache. D. Photophobia. Answer: B. Bradycardia. 10. Which assessment confirms peritonitis in ruptured appendix? A. Abdominal rebound tenderness. B. Hyperactive bowel sounds. C. RUQ pain. D. Murphy's sign. Answer: A. Abdominal rebound tenderness. 11. Which electrolyte imbalance causes U waves on ECG? A. Hyperkalemia. B. Hypermagnesemia. C. Hypocalcemia. D. Hypokalemia. Answer: D. Hypokalemia. 12. Patient with liver cirrhosis shows asterixis and confusion. What is the cause? A. Hypoglycemia. B. Hepatic encephalopathy. C. GL bleeding. D. Alcohol withdrawal. Answer: B. Hepatic encephalopathy. 13. First action for a patient with chest pain and ST elevation? A. Administer nitroglycerin. B. Draw troponin levels. C. Notify provider. D. Prepare for PCI. Answer: D. Prepare for PCI. 14. What complication is expected in DKA but not in HHS? A. Dehydration. B. Kussmaul breathing. C. High blood sugar. D. Altered lock. Answer: B. Kussmaul breathing. 15. In hypovolemic shock, which finding is expected? A. Hypertension. B. Bounding pulse. C. Cold, clammy skin. D. Bradycardia. Answer: C. Cold, clammy skin. Which lab confirms rhabdomyolysis? A. Low potassium. B. Elevated calcium. C. High amylase. D. Elevated myoglobin. Answer: D. Elevated myoglobin. 17. Which sign is a contraindication to thrombolytic therapy? A. History of stroke 8 years ago. B. Platelet count of 200.000. C. Recent GL bleed. D. Chest pain for 1 hour. Answer: C. Recent GL bleed. 18. Patient with COPD on oxygen has a respiratory rate of 8. What is your first action? A. Turn off oxygen. B. Call the provider. C. Assess ABGD. Administer naloxone. Answer D. 19. A client with Cushing's has moon face and purple striae. What is the priority? A. Assess for suicidal ideation. B. Check glucose. C. Monitor BPD, assess infection signs. Answer: D. Assess infection signs. 20. Which drug is withheld in contrast dye imaging? A. Lisinopril, B. Aspirin, C. Metformin, D. Furosemide. Answer: C. Metformin.